Hearing. For much of our life, it's as natural as breathing. You listen without thinking, converse with ease, wake from sleep to the subtlest of sounds. Yet little by little, things have changed. You realize how often you have to ask people to repeat themselves, how exhausting it's become to attend a meeting, and how the TV is too loud for everyone but you.
It's estimated that approximately 30 million people suffer from hearing loss, and if you consider that by gender, more men suffer from hearing loss than women. But if you look at it by age, some studies show that children under the age of 18, about 15 out of 1,000 children suffer from hearing loss, but these numbers increase as we age. So about 30% of people age 65 to 75 suffer from hearing loss, and then about 50% of people age 75 and above suffer from hearing loss.
While hearing loss isn't reversible, most age or noise-related loss can be managed and often compensated for. Occasionally, for a few, that means medication or surgery. But just as eyeglasses are used to correct most vision problems, hearing instruments are used to treat most kinds of hearing loss.
Hearing aids cannot restore nerves or damaged hair cells, but they can help people with hearing loss detect sounds that they couldn't detect otherwise. When I talk to my patients that wear hearing aids and I ask them how the hearing aids have affected their lives, most of my patients say that they would be lost without their hearing aids, or that they would feel completely disconnected from their family without their hearing aids.
Unlike eyeglasses, hearing aids are not necessarily a quick fix treatment for hearing loss.
The trick with hearing aids, they're not like eyeglasses. You can't simply put the prescription on and walk out the door and hear clearly as you can with eyeglasses. It takes time and patience for your brain to relearn how to use the sounds of life.
Every hearing instrument is a miniature conglomeration of electronic circuitry encased in plastic and contains three basic components: a microphone that picks up sound, an amplifier to boost the sound, and a receiver that delivers the amplified sound into the ear. All are powered by tiny batteries. In recent years, digital technology has enabled hearing aids to get smaller and more sophisticated.
Digital technology has improved the listener experience in a couple of different ways. With the shrinkage in components inside the hearing aid, we can pack more information inside there. So small computer programs can manipulate the sound. A listener walks outside wearing their hearing aids, the wind blows across them or loud noises come by that might be uncomfortable. We can recognize those and modify them to keep the listening comfortable for that user.
Starkey Laboratories, based outside Minneapolis, recently developed a line of hearing aids that uses nanoscience in its design.
We can put a patient in a real-life situation right there in the clinician's office, have them pretend like they're driving a car or eating in a restaurant to demonstrate the features and functionality of that hearing aid.
Nanoscience and digital technology is delivering a brand new listening experience to those with hearing loss.